Well, good afternoon, everyone. We'll just wait until people join and we'll get started with our very exciting webinar this afternoon. I can see lots of people joining right now, so we'll just wait a minute or so before we get started, just to give everyone opportunity to join. All right, we might get going. Thanks, everyone, and good afternoon and welcome to the NHMRC Partnership Centre in Health System Sustainability webinar. This is one of a series of webinars that we have undertaken and are continuing to deliver to you. And today we're speaking about shaping a sustainable health system through collaboration, and we're particularly excited to have some consumer advocates with us today because we're actually looking at collaborating with consumers, the most important people in the health system for whom this health system actually exists. So we're very pleased to have Leanne Wells, the CEO of the Consumers Health Forum of Australia, Linda Beaver, and Jahin Tanvir, both of whom are consumer advocates, and we'll bring them in to a panel discussion after Leanne gives her talk. But right now, I'd just like to invite you to please be interactive with us. Use the Q&A function on your Zoom platform. Ask questions, make comments. We will endeavour to answer all of your questions during the session, if at all possible. If we don't get to everyone's questions by the end of the session, we will endeavour to answer them by email. So we will get going. One more reminder, we are recording this and it will be on our YouTube channel. So if you have people, of people who couldn't make it today, please just let them know. And we will let you know when it's up on our YouTube channel. All right, so without further ado, I would like to just introduce the Partnership Centre and what we're about. And before we start, I would like to acknowledge the traditional custodians of the lands from which all participants are joining and pay my respects to their elders, past, present, and emerging. And I would like to extend that respect to all Aboriginal and Torres Strait Islander people with us today. So the NHMRC Partnership Centre for Health System Sustainability is a large grant. It's a 5-year collaboration involving 17 lead investigators, 20 expert advisors, and over 40 system implementation partners from around Australia, including the Consumers Health Forum of Australia, from whom you'll be hearing today. The PCHSS is a national grant. And as you can see from the map, the PCHSS investigators and system partners span all Australian states and territories and work in many different sectors, including academia, public health, in hospitals, in private health, health insurance, government, not-for-profit healthcare, and of course, in consumer representative organisations. The PCHSS is guided by an international advisory group and a scientific advisory committee, and is overseen by a governance authority comprising representatives of the NHMRC and each of our funding partners. So the vision that we have is to produce research that contributes to the development of a resilient healthcare system, one that is affordable, cost-effective, and delivers improved health outcomes for all Australians. And our purpose is to generate and disseminate ideas and evidence and to improve the performance of the health system so that it delivers care efficiently and effectively over the long term. And we seek to maximize health system improvement in the real world by bringing together people who provide, plan, and need care. So the PCHSS has three main research themes which address different aspects of health system sustainability, and the Observatory on Health System Sustainability, which is the unit that's actually bringing you this webinar today, is led by myself, Yvonne Zurynski. So I'm the Associate Professor of Health System Sustainability, and together with Professor Jeffrey Braithwaite, I lead the Observatory on Health System Sustainability. But we focus on three interlinked themes: analytics, technology, and shared data. And they tackle important questions in informatics and healthcare, including using big data to improve care, diagnostic testing and medication management, as well as designing analytics to guide better healthcare decisions. And the researchers are also examining how telehealth might best be deployed and funded to improve healthcare across the country. And we've certainly had a lot of experience with that just recently through the pandemic. The second theme is reducing waste and low-value care, and that's focused on finding ways to reduce wasteful or low-value care, which accounts for about 30% of all healthcare, and to deliver needed care more efficiently and effectively. And the better value for the health dollar theme covers four major areas: using financial incentives for better value healthcare, priority setting and decision-making in healthcare organizations, impact of markets, competition and choice in healthcare, and the impact of collaborative research programs on cost savings and efficiencies in healthcare settings. And I've already introduced the Observatory. Okay. This is just to demonstrate that over the last 3 to 4 years, our network of collaborators has grown substantially. And it really reflects the way that we approach our work. To change the system, you really need to collaborate. And so, you know, we really reach out to lots and lots of different partners, and we work with the system in order to change it. And that's the only way that we can do this. And of course, consumers, health consumers and consumer advocates are of the utmost importance in that network. And we've been working with Leanne and her team very closely on a number of projects over the last little while. And we've actually published some papers together, which is really exciting. So I will stop sharing my screen and ask Leanne to share hers while I introduce her. So Leanne is the Chief Executive Officer of the Consumers Health Forum of Australia. She has held executive positions in federal government and non-government organisations and served as CEO of national peaks and local service delivery organisations in the primary care sector. She is a health advocate and service executive with over 30 years experience in health and social policy, program and service development. Leanne has broad experience in health, in governance, and is currently board director of Coordinaire, South East New South Wales Primary Health Network, the ALS Help Foundation and the Australian Pharmacy Council. She is independent chair of Coordinaire's Community Advisory Committee and chair of the Commission of Quality and Safety Patient Advisory Group. She has several advisory appointments, including the Commonwealth's Primary Healthcare Advisory Group, the National Preventive Strategy Advisory Committee, and the OECD Paris Patient Advisory Panel. So clearly eminently qualified to be telling us about how we might collaborate to change and improve the health system. Over to you, Leanne. Thank you.
Thanks for that introduction, Yvonne, and look, fabulous to be here. We are a partner of the Partnership Centre at CHF, and we've had a fabulous partnership over the last 3 or 4 years. As Yvonne said, we've published together, we've run thought leadership roundtables together, and importantly, we've collaborated and will be repeating the Australian Health Consumer Sentiment Survey this year. It's all about, that's just one example of how we can collaborate across the research consumer communities is on research and in really systematically, drilling down into consumer insights into the system. So thank you for that welcome. Like Yvonne, I'd like to acknowledge the traditional owners of the country that I'm meeting on today. That's the Ngunnawal people here in Canberra, and recognise their continuing connection with land, water and community. And I'd like to pay my respects to them and their cultures and to elders past, present and yet to come. So what I really wanted to start with was to comment on, what are the pain points or the pressure points in the system from a system perspective and also from a consumer perspective. So there's several pain points in the system. There's several points where we need to improve the healthcare system. And the first is the system itself. It's divided. We've got divided services and divided systems. So from a consumer perspective, the constant comment we hear is one of fragmented, poorly coordinated care. That's a product of a system that doesn't connect well. Commonwealth state divide of services, poor bridging and linking between primary health care and aged care and hospital care, those sorts of things. Here we go. Can you see that now? Okay. Yep. Probably on slide 3, Kaylin. We've also got barriers to development and diffusion of healthcare innovations. If it's anything that we should expect as taxpayers and as consumers is a world-class health system. And generally we do have a very good health system in Australia, but probably what we're not so good at is getting smart stuff happening. And often there are, structural and other impediments to that. And often it's a product of, can you just go back to the previous slide? Sorry. Yeah, often it's a product of funding models. For example, Medicare fee for service, we often hear is not fit for purpose anymore, or we need to supplement it with other ways of funding services so they can be more personalised, more agile. Another system pressure point is the fact that the system is managing so much more multi-morbidity these days. Care is increasingly complex, care management is increasingly complex and costly. We've got new public health challenges. We've got obesity, loneliness, isolation. We're much more concerned and should be about the social determinants of health. Healthcare responses need to take the social determinants of health as seriously as they do medical interventions. And we've got all sorts of other things affecting the way consumers experience the system right here, right now. Climate change, disasters like bushfires, and the pandemic, the topic of the month. Health literacy is a system issue. It's a very important systemic issue. It's essential that we build health literacy in the community if people are to have the services they need when they need them, and the capacity to navigate and have knowledge of those services. Digital inclusion and exclusion is a really topical issue as well. It's one thing to have access to telehealth, Medicare subsidised telehealth, but if you don't have devices, if you don't have NBN coverage, if you are just not confident with that mode of delivery, then there are inclusion and exclusionary issues there at play. But But I think first and foremost, and the Productivity Commission's big report in 2017, Shifting the Dial, really underscored this. It was a deep dive into what we need to do to improve our health system. And it made the comment that patient-centred care is unfinished business and certainly not the dominant model in our system. So we've got a system that's not optimally geared around consumer preferences, needs and values. Next slide. So again, closer to home, the consumer experience, and this is from the Australian Healthcare Consumer Sentiment Survey, but it's borne out in several data sets, surveys conducted by several of CHF members. The themes come through time and time again. Fragmented, disconnected care. The make it easy for me plea is a common one from consumers. Access and affordability is what plagues our consumer experience of our system. We've got widening out-of-pocket costs, and that's for people with and without private health insurance. We've got widening health inequities, and we've got the emergence of the digital divide, as I said before, and we've got pandemic fatigue. So the issues for our health system, we generally get good health outcomes, good clinical outcomes when people finally do get to care, and we compare well to other Commonwealth countries on that metric. Where we rate mid-range is on other measures, the access and equity measures, and that's of concern. Next slide. So ways to build a better health system. I just wanted to draw your attention to a few key publications here. The Productivity Commission Shifting the Dial report mentioned earlier, but some recent contributions that CHF has developed to the national health policy debate. Our Shifting Gears publication in 2018 recommended 8 policy shifts for change. If we want to improve the system, there were 8 fundamental shifts we called out that we wanted to see. I'll talk about those in a moment. We published a diagnoses and set of prescriptions for making health better in a major report from our Consumer Commission that we put together, a COVID Consumer Commission last year. And I'd like to also come back to the experience of the health system by young people. They're often the forgotten voice, and we think their voice and their experience of the system is very important. So next slide. So this is a summary of our Shifting Gears publication and the eight fundamental shifts for a better patient and person-centred care. But I won't go through all of these because I think it's important to get to the conversation. But, other than to point out a few key and fundamental shifts, and we're on that journey, but we're not there yet, is we really need to be shifting from low to high value care. We need to make smarter use of healthcare budgets and the partnership centres researching heavily in this area. How do we strip waste out of the system? How do we spend less on low value interventions? What are those low value interventions? And how do we spend more on the most effective health activities? How do we spend more on higher value care? And the value lens, value-based healthcare lens, obviously consumer preferences, needs, and what they value is an important part of that equation. It's not just about cost. Another important shift we think is really to have local responses, a sense of community control and community involvement and participation in shaping healthcare services and determining what healthcare services exist and are invested in much closer to the ground. So, the fundamental role that PHNs are or could be playing in collaboration with local hospital networks to commission projects, commission services, to innovate within their footprints in a way that genuinely takes into account some of our geographical differences across the country. And I think just to conclude there with, you know, that we need to shift so much more from that experience of siloed care, disconnected care, to collaborative, integrated care that's organised around a person and their needs, including their families. So next slide. Next slide. Yeah, this is a, probably just go back to that table. Yeah, this is from our Making Health Better Together report from our Consumer Commission last year. And we built a lot of consensus. We had about 35 commissioners, and we did a series of about 25 interviews with national health leaders. The big call outs in terms of diagnosing where there were problems in our system spanned those 5 areas there. And the ideas, the prescriptions for what we needed to do about those are articulated there in that table. Next slide. So this is just a summary of some of those recommendations. So digital health, that's the next horizon. We need to be much more aggressive and progressive in investing in mental health and wellbeing. Integration and care coordination, they're words that flow off the tongue very easily, but in terms of specific measures, what will help bring that about? So there were recommendations in there about, you know, there being much more support for consumers through a network of care coordinators, a national social prescribing scheme, permanent increases to income support payments if we're serious about doing something about health equity. Urgently building more social housing. So, you know, the Consumer Commission was very much responsive to, there's much we can do to support better coordinated medical and healthcare, but that can be very easily frustrated if some of those social determinants are working completely at odds with those. Next slide. And just as I said, I did want to come back to the voice of young people. We need to focus much more attention, I think, on children and child and youth health to establish health for life. We need youth appropriate services. We need to overcome the fact that too many young people fall through the gaps of a health system that's just not designed for them. And we know that young people face many barriers to accessing services that that are often more profound than the rest of the population. And these are not my words, these are words directly from this report that we published with the Wellbeing Health and Youth Centre for Research Excellence in Adolescent Health earlier in the year. And that came up with 6 challenges and 5 key areas for recommendation. And not surprisingly, digital healthcare delivery and advancing solutions there that are youth appropriate and youth accessible was one of them. Navigation support. The health service system is very difficult to navigate for young people, ranging right through to some really practical recommendations like age consistency across jurisdictions for at which young people can access services. And the really wicked problem, or one of the really wicked problems for young people is the paediatric to adult service transition. Again, there's so much scope for reform and improvement there, so that they can be set on a path to good healthcare and treatment and not fall through what is sometimes a chasm. So just a couple of concluding remarks then on the last slide. So I guess some brief takeaways, and these are just some short perspectives, but what should the direction of the Australia's healthcare system be? Health system sustainability is at risk if we keep doing what we're currently doing. We've got the evidence, we've got decades of strategies in preventative health, in primary care, and a broad consensus on priorities. It's really, I guess, from a probably a frustrated consumer perspective at the moment. It's got to be about implementation of that evidence, of those decades of strategy pieces where several experts have sat around the table designing prevention strategies and prevention and primary care strategies, for example, in the past. And value-based healthcare is the critical lens that we need to put on everything, and the critical lens through which we need to understand and respond to consumer experience as we frame policy programs and services. So there's a little wish list there. I won't read through all of those, but just to draw out a couple, we do need to rebalance investment towards prevention and primary care. We do need to reimagine person-centred primary care models and to be thinking much more broadly about, you know, it's got to be much more than just a visit to the GP. We want to see social prescribing. We want to see self-care programs. We want to see digital health taken up, but that needs to be enabled through things like digital mentors and navigators. And we want to see regional action through work that some of the PHNs are already leading in New South Wales around integrated care and collaborative commissioning. Virtual care is the next revolution. We want to see that deployed for consumers so that they can play an active role in managing their health using digital platforms and technologies. But we've got to be really, really mindful of not widening that divide. We've got to bring everyone with us on that virtual care journey, or digital exclusion will become even more of a thing than it already is. And finally, and you'd expect me to say this, consumer voices, consumer leadership, and consumer insights need to be systemically supported and valued at all levels, whether that be at the policy table, in research and in service design. So hopefully that's stimulated a few thoughts and a basis for a bit of discussion. Thanks, Yvonne.
Thank you so much, Leanne, for a fantastic presentation and lots of words of wisdom. And I'm sure there will be lots of questions coming in through the Q&A. Please post your questions up, because we have a full half hour for discussion. And whenever I've been in a forum where consumers are involved, we never run out of ideas to discuss. So please post your questions. But before we go into the discussion, I'd like to introduce our other panelists. So we've got Linda Beaver online. Linda, reveal yourself, turn your camera on. There she is. So Linda has experience in the health sector. Her experience is extensive and highly varied, from clinical practice to education and management in the public and private sectors, as well as at university and at non-government organisations. Linda, maybe you tell a few words about yourself rather than me reading this out.
Thanks so much, Yvonne. It's great to be here this afternoon. I think one of the things that drives my interest and involvement in things consumer health related is, having come from a health service background and across many areas, to see that, you know, we're still involved in a situation where, as a health consumer, we're still being told what we need to do. And I think that's the challenge, because part of the difficulty is, with all these amazing things and policies and research, is that the person just there in the waiting room or lining up at the pharmacy is still being told what to do, rather than those simple questions of, so how can I help you? Is this going to suit you? Opening up the opportunity for that conversation. So this is my driving force. It's talking to people and getting their feedback. And that's how my passion and continued interest and involvement has developed, talking to people.
Fantastic. Thank you so much, Linda. I'll just throw over to Jahin. So Jahin is a commissioner at Wellbeing Health and Youth, which forms the Centre of Research Excellence in Adolescent Health. Jahin, tell us a little bit about where you come from and what drives you and your work.
So hey everyone, first of all, it's an absolute pleasure to be here today. For me, I think it's just about bringing the perspective of a young person, as well as being a young person of color. I think when we have discussions about healthcare or just any policy in general, that aspect of young people is always unheard or not given as much importance. But at the end of the day, that role is exceptionally important, because that age group, that that growth period is so essential when it comes to developing how they navigate the healthcare system as they get older, how they treat their families, for instance. A lot of young people of color from minority communities, they have an added responsibility to be that torchbearer, to be that person to navigate the healthcare system for the other people in the family and community. So I think for us to understand that young people play a crucial role in how the healthcare system is structured, and how we can better facilitate those discussions and bring them to the forefront of discussions, I think is very important. I think that's what my point of view is from.
Absolutely. Thank you, Jahin, and thank you for being here today. And it's, we need to look after our young people so that we have a healthy population. There's no two ways about that. And navigation is one of the things that has been brought up a couple of times, both by Linda and by Leanne and by Jahin. How can we improve navigation? If I can just kick off with the discussion. Any one of you, jump in. What should happen to improve navigation of the health system?
Can I just perhaps comment on this, Yvonne? I think the navigation is challenging when you're adept at understanding the health system, let alone when you suddenly get thrown into oh my gosh, I've got to go to a hospital, I've got to get there, I'm being told I have to get these tests done. How do I access that? And especially from a rural perspective, access is really challenging. So that adds a really significant complication to navigation of a health system. Not knowing where to go, how to get the best service, and what is cost effective and viable all start to underpin how people can get to the first step of that health service navigation. So there's almost a role in a practice environment to have somebody who acts as a support person, to provide resources, to provide information, to be the intermediary, to assist somebody to understand the processes, the rules, the expectations, the sorts of services that are available, when they're available, how you get to them physically, and so on and so forth. It's really very complicated. And I think we need to have some backup systems evolving to assist people to understand what's available and how they can manage their way through that very complex pathway.
And I think you're right. Even those of us who know the system quite well find it quite difficult when we have to navigate it ourselves for our own health. That's certainly been my experience in some instances. Leanne, do you want to comment on that?
It's enormously frustrating, isn't it? Because it's not, obviously rural Australia, there are some areas where we do have a shortage of services and workforce maldistribution, but for the most part, the frustrating thing is the services are there. It's navigating to them and making sure they're connected up. So I think we need to see more of and welcome ideas like the care finders. Care finders were announced as part of the response to the Royal Commission in Aged Care for older people. They're designed to fulfil that very function that Linda was describing for old people. But there's not a single solution to this. I think that, in terms of navigation, there needs to be better health literacy, better knowledge of services. There needs to be care finder, workforce type measures, and information being opened up. There seems to me to be a goldmine of information about local services in the health pathways initiatives that all the PHNs have and that GPs have on their desktops. Wouldn't it be great if we could open those up to community access as well? And just a final comment on you know, service navigation, it's not just about navigating healthcare services either. It's also about navigating into and accessing some of those really fundamental social supports that can make such a difference to someone's chronic care management and recovery. You know, so we know that in the UK, for example, and in Ontario and Canada, where they do have more systemic social prescribing schemes, they have a link worker there to again, link people up. GPs don't have the time to do it. They may well recognise that someone could really benefit from tapping into a support service or an art class or whatever it might be, but you know, but not have the confidence to get there themselves or to make that first move. So link workers and all the evaluations that I'm aware of around social prescribing schemes in those countries were you know, were one of the game changers that made a difference to how those schemes benefited patients.
Yeah, absolutely. And certainly in that survey that we did together, Leanne, we showed that, you know, people with chronic conditions find it really difficult to know what healthcare they're actually entitled to and where to get their healthcare, how to access healthcare. And, you know, health literacy in terms of navigation and being able to engage with healthcare providers is low across the world, but in Australia as well. So that's something that we need to increase. And I think that's a two-way discussion. It's not just, you know, you consumers need to increase your health literacy.
Knowing what you don't know, if you don't know what you don't know, you don't know what to ask for. You know, there's a lot of consumers out there that I'm aware of that don't know that they're eligible if they've got a chronic care plan for 5, I mean, it's not enough, but 5 subsidised Medicare allied health services.
Yeah, I might just bring Jahin in here, because I'm sure, you know, young people also experience this and many don't know what they're actually entitled to in the health system. Can you comment on that?
Yeah, absolutely. I think when you look at navigation, a lot of the focus needs to be heavily put on the barriers that exist from young people accessing their services. So for instance, if we look at minority communities of young people, you have, you know, things like stigmas, taboos, you know, negating them from accessing mental health support, for instance, support that they're, you know, not only have the right to, but also they're entitled to have, you know, those fundamental services. So when we have that, you know, for instance, intergenerational gap, those, you know, lack of education in those communities, they're not getting the necessary treatment that they really need, because obviously mental health is such a, you know, essential component to, you know, overall well-being. So when we look at that, we need to address those barriers, have those conversations in those specific culturally tailored communities, and just address those barriers, because if we can't navigate the system to allow them to access, you know, what they really need and what's fundamental to them, you know, we're really, you know, creating those, you know, issues in the future and their long-term future as well. And as Leanne and Linda mentioned, health literacy is such a fundamental component. When we look at rural and regional communities of Indigenous young people, or just, you know, minority communities in general, health literacy isn't given as much importance as it should be, especially post-COVID. You know, we're seeing so many different situations where young people are finding it confusing, you know, vaccines, Medicare, access to, you know, different healthcare services in their local area. How are they going to, you know, communicate with their doctors, their GPs? These fundamental things are, you know, absent. And I think more and more needs to be done with different organizations and obviously the government in general to promote this and also raise awareness.
What do you think about having a unit on health literacy in high school?
I mean, absolutely. I think when it comes to education and implementing those things into the curriculum, you know, it doesn't get better than that. But if you have regular, you know, lessons, or just allowing them to understand that this exists, this is how you can access these services, you know, education is, I think, is the first and foremost thing that we need to start, you know, integrating things into, and then obviously slowly going to different communities, tailoring them for, you know, different languages, for instance, and just different ways of communicating as well.
So I might just move to the questions, because there are a couple of really interesting questions that have been posed. This one's from Penelope McMillan. Thank you, Penelope. So she says, Leanne mentioned that implementation is a major barrier. It's not that we don't know what needs to happen. So how can consumer health advocates help to drive implementation of change as opposed to simply designing proposals for change?
Okay.
Linda.
May I comment?
You may indeed.
I think some of the barriers, and I'll focus on that word, to implementation will be that as health consumers, we still aren't given permission to actively question or ask or be prepared to say, nah, look, that's not going to work for me. What else can you offer me? That level of dialogue is not something that people are generally fairly comfortable about utilising when they're in that consultation process. And I think that's one of the real stumbling blocks to embrace implementation. And we talk about health literacy, but I'd like to broaden that into one word, which is communication. And that really covers everything. How we communicate as health consumers with our health service providers. And that goes across the primary system right down to the retail environment. You know, we need to be looking at the whole picture of health communication, but also enabling people to understand that they have these rights and responsibilities. We don't know that yet. We should, but we as consumers don't know that we have rights to access and service and communication and privacy and all the other things that are so well entrenched as expectations in the health system. It's not out there in the community. And so we still have this quite narrow model that we're working in every time we go into a health service consultation, be it an allied health or a GP or a specialist. So I think that very fundamental level of implementation needs to come back to teaching people that they have these rights and expectations. And if we can get people to be more comfortable and confident in that process, then implementation is going to flow a little more naturally, is my considered opinion based on what I'm hearing out there in the communities.
Yeah, and I guess also having the opportunity to ask questions, with the sort of time constraints of consultations, like 15-minute consultations, it's actually quite difficult to bring that up and have the opportunity. And it's our health professionals that need to also think about how they provide that opportunity to those with whom to whom they provide care. Leanne, would you like to comment on the implementation aspect?
Yeah, and the question was really, how can consumer advocates help to drive implementation change? Well, yeah, they can help to drive implementation change. We say all the time that consumers are change agents, and they can serve that change agent role at all points in the system, right from the point of care delivery, where Linda's describing, if consumers are equipped and feel confident and are supported to ask questions and have that genuine partnership in care approach, you do get better health outcomes. We talked at our summit earlier in the year about the notion of the wise consumer. I think Anne Duggan from the Safety and Quality Commission sort of introduced that term. So we need service providers educated, as Linda said, to think about consumers as sort of wise collaborators and wise and informed collaborators in shaping their care. But we need the system, we need this sort of really disruption in the attitude in the system to the change agent and constructive and positive change agent role that consumers can play, which is why we talk about 8 different roles or a typology in our Shifting Gears publication. I think often decision makers think of consumers and consumer advocates or consumer representatives as one homogenous group. It's more nuanced than that, and it needs to be more nuanced than that. A good consumer advocate can be as powerful a service designer as a clinician, just bringing a different set of skills. They can be co-researchers. They can sit at a policy table and help shape and determine policies as much and often more effectively, I would argue, than policymakers, because they're bringing that lived experience. So I think we just need that system change and an attitudinal shift. Someone in the box here is talking about, is it time, for Australia to have patient directors as they do in the UK? So again, right through to consumers and the role they can play in governance and in organisational leadership. So that's where we need to be. That's not going to come about overnight. And those sort of changes happen when there is attitudinal shift, but also genuine commitment and investment to that kind of consumer leadership, which is very different to what we have now.
Yeah, thanks, Leanne. I think that talks to this other question from Anonymous. Seems consumer involvement in Australia is at a very tokenistic, mostly at a show and tell stage with consumers, where you have to repeat their stories. Jahin, you guys are the future. How can we change this? How can we, implement for change?
Well, I mean, when we talk about, this whole process and the idea of representation and the idea of having navigation as young people, and from that perspective, as unfortunate as it is, we're not given the amount of importance when it comes to having our voices being heard. I think the furthest that we've gone, and as part of Wellbeing, Health and Youth, which have done very perfectly, is co-design, having young people part of the process when it comes to research, for instance, or consultations. How can we better, create health research? How can we better communicate with the government, different organisations? So I think that part, again, comes back to the whole design process of allowing young people to be given a voice. But when we actually talk about implementation, unfortunately, it comes back to the whole idea of just ticking a box. Tokenistic representation of young people are present, they're there for the sake of it. But if we don't really create, again, as Leanne mentioned, a system where young people are given, a seat on the table, whether it be in, government meetings, for instance, or consultations with the government. A lot of the consultations these days happen with, external organizations. And as great as they are, the end result and the outputs that we're contributing to isn't made clear to us, other than just, a simple report of statistics, which again is obviously great research. But if we don't see our voices and our concerns and our stories being represented to the degree that it needs to be, it just demotivates young people and just makes them feel more hopeless. And I think more structures, facilities, more events need to be there to tailor for young people and to say, hey, what you're saying right now will be taken to the appropriate decision makers. You'll be given an opportunity to create like a Senate inquiry, for instance, or just be there and talk to a minister. And I think that facilitation needs to be done so that we can create a more sustainable future for young people, and also not create that whole environment of destruction where young people don't feel like they're contributing at all.
Yeah, that's great. I love the way you talked about co-design, and that's so important, not only for young people, but through the whole lifespan. We need to be listening to people and actually acting on what their needs are within their own contexts in order to make change. There's a question here which is very long. From Steph Top. So a lot of what each of you have been talking about speak to the fundamental power relationships that shape our health system at the macro level, federal state financing at the meso level, medical hierarchy that influence integrated interprofessional care, and the micro level patient-provider relationship. Oh, it's for me. Yvonne, I'm interested in how the group envisages its role in relation to investigating and bringing evidence to bear to change these power relationships. Fantastic question, which I probably can't answer in 2 minutes, but the Partnership Centre certainly addresses all of those levels. So we're working around, what information is actually shared in the consultation. Is there shared decision making? How do we get more information and the appropriate information to both the clinicians and the consumers, and bringing consumers and clinicians onto the same page so that they have the same sorts of information? which will assist them in shared decision making. And we're certainly involved in working with departments of health at the highest levels to improve sustainability and to improve better value care, to improve prevention. So yeah, it's a big ask, but we are trying to implement new models of care and evaluate those at those different levels. Okay, I'm just looking at my other questions. I might just come back to, we've talked about young people, Jahin, but there's a question here about digital health and the older population. What would be the strategies and recommendations for including everyone, especially the older population, in digital health? Leanne or Linda? How do we do that?
Linda, do you want to go first?
Yeah, thanks, Leanne. I'm happy to just throw a comment about this. One of the things I hear from people out there in the community around the country is that digital health is great as one element of health service provision, but it's got limited capacity in many ways. And that's probably the biggest, most consistent comment I hear. It's great, it's wonderful, it's helped a lot of people through the last 12 months. However, you can't beat that sitting, looking, that examination, that touch, because that's what health is about. It's about examination and touching, examining physically. That doesn't happen through the telehealth modality or the digital health modality. And those things, even from a consultative viewpoint, we can be chatting and it's great, but you don't know that I'm sitting there shredding the leg of my pants because I'm so anxious and nervous about the conversation, because we don't see that. Whereas in that one-on-one consultation, that whole physical dynamic and observation becomes much more powerful. So yes, it's got a really strong place, but it's a place only as part of service provision.
Thank you. And I hope you're not shredding your pants at the moment. Leanne?
Look, I think Linda's spot on there. We've just finished a major piece of research looking at consumer experiences and preferences around telehealth, and that came through very strongly. And there's a trade-off point. I think older people are already included in digital health because we've seen uptake of it and associated things like e-prescribing in the last 18 months of the pandemic. But when it comes to a quality telehealth or digital health experience, which is really important, obviously from a consumer experience point of view, that was resoundingly the message that telehealth's good for convenience and cost, but the preference is very strongly for telehealth as an adjunct or an integrated part of what someone's otherwise delivered, face-to-face by a trusted doctor, nurse, pharmacist or team that they have a relationship with. People felt quite uncomfortable, as Linda said, talking about, complex health issues with, often, a clinician they didn't know. Sometimes it's necessary. Some access is better than no access, but in terms of overall patient experience and quality, that was the message.
So it's horses for courses is what you're saying. One size does certainly not fit all. And in certain instances, it's a great thing, but in others, it falls over. It's limited. Jahin.
There's courses, other dimensions to digital, remote monitoring, those sorts of things.
Yeah, remote monitoring and apps and sort of self-management tools and so on. I wonder if I could go to Jahin, because, often when we think of apps and, doing those sorts of things, we think of young people, although that's a misconception. I think we do it across all age groups. But Jahin, what are your views about that? You know, using apps to self-manage symptoms, etc.
Yeah, well, I completely agree with Leanne and Linda. I think the way we're going forward in this world is, you know, the digital age is the most important thing right now. But again, like you mentioned, the misconception that obviously young people spend a lot of time on social media and apps, but it's not like we understand everything that's going on. There's a lot of aspects that we're still trying to learn, and that we'd be very grateful if we had external, you know, education on, and how we can better manage, you know, our own overall well-being with these apps. But I think, again, when we talk about young people, we can talk about education and curriculum. And similar to when we talk about the, you know, more older individuals in the communities, we can talk about having, you know, more community groups, more community sessions to explain how these apps work, how they can benefit us, how they can, you know, really allow us to, you know, enhance our lifestyle. And I think it goes, you know, both ways. When we talk about young people, we talk about the curriculum and what they're, you know, more acquainted to, like the school curriculum, you know, school youth groups. But then when you talk about the other side of the spectrum, we have to also talk about, you know, community groups, community sessions, and in both senses, it's about educating. It's about educating these communities, how they can better their lifestyle, and at the end of the day, you know, move towards a more digital lifestyle, which is inevitably what we're going towards.
Yeah, and in fact, Andrea followed up that question with, you know, she's thinking, she or he, I'm sorry, is thinking about using mobile apps for self-management support, for example, among older people. And indeed, there must be a place for that as well. Okay, look, we're coming towards the end of our session, and I knew we would not be short of discussion. It's been fantastic. Thank you so much, everyone. If there are no other questions, all that we need to do is say thank you so much to Leanne. Thank you for being a co-researcher and a co-policy maker. It's been fantastic, and thank you so much for stimulating a really great discussion. Linda, as always, lots of pearls of wisdom from your experience and your views. Thank you so much for being with us. And Jahin, we really like to hear what young people think, because you guys are honestly the future, and so we need to be supporting both the young and the old and the in-between to access the care that they really need to access. So I might finish up now and just remind you that this will be on our YouTube channel, and you'll get an email from either Genevieve or Kaylin once that's up. All right, thank you so much. It's been a wonderful, wonderful session.